What's up YouTube? I'm Mike and today I'm back with a little conspiracy theory video. This is actually a follow-up to the video that I shot earlier today titled How to Increase the Adult Height of Adolescent Boys. Even if you're not interested in that topic, you should go back and watch that video, or at least pay attention to this one, because I think the article that I'm about to read you sheds a lot of light on why it is so hard to get good medical data about all of the things that we can do with our bodies, from a performance enhancement to a growth. Basically anything that you would try to change about the human body is mired in levels of ethical issues, which is what we're going to be talking about. I apologize if you can hear that water pipe behind me. My wife is taking a shower. It drives me mental recording these videos while she's in there, but it's sometimes the best time that I have to record videos. So what we're talking about today is what I think is, it's not really a conspiracy, but it's a problem with the medical community and how it kind of screws all of us as bodybuilders and really anyone who just wants to improve their quality of life. Since making that video, I have talked to quite a few people have reached out to me who are adult men who are short, talking about how rough they consider their lives to have been due to their height and what a game changer this might have been for them as young children. And so one of the things that I was curious about in all of the medical data that I have found about using human growth hormone and now HGH plus anastrozole to increase the height of adolescent boys or children in general, it's always dealing with children who have growth hormone deficiency. So I began wondering, does this only work in a child that has growth hormone deficiency? To me, it wouldn't logically follow. To me, I would think it would work even better in a child that does not have growth hormone deficiency. So I've been digging in to try to find out more about this topic, and I came across this article that I'm going to read to you from today. I'm going to link this one in the description. I'm not going to put it on the screen because it's kind of lengthy. So you're just going to have to, a lot of you guys listen to me in the car anyway, so you can't read your screen. The article, the title of this article is HGH for Short Stature, Ethical Issues Raised by Expanded Access. This is in the Journal of Pediatrics. So follow along. When the only source of therapeutic human growth hormone was pituitary-derived GH, rationing of this precious resource was a necessity. So that's something to think about. The access that we have to recombinant growth hormone is relatively new in human time. Used to, it can only be derived from the pituitary gland. So it had to be basically harvested from a living being, I guess. I didn't research to find out how they harvested the GH, but I'm assuming it was either from a cadaver or it was extracted from someone's living tissue. So obviously, as they were saying, it was a precious resource, basically. Recombinant DNA technology made HGH abundant, but this abundance also brought uncertainty, controversy, and discomfort to practitioners trying to practice ethically responsible medicine. Early debates focused on two central questions. One, if HGH were proven effective at increasing the height of children without growth hormone deficiency, would the diagnosis of growth hormone deficiency be morally relevant in determining entitlement to HGH treatment? There is a whole lot to unpack in that statement right there, and it really goes a long way to explain why there's such limited data. If they discovered that normal kids could be made taller by using growth hormone, would it be fair to deny them access to it purely because they were not diagnosed with the disease called growth hormone deficiency? If they're totally normal, is it ethical to give them the growth hormone and help them become taller than they naturally would be? Number two, regardless of underlying cause, should the treatment of short stature be considered a medical problem justifying medical treatment? And if so, to what degree? We argued that HGH effectiveness and serious disability, rather than the designation of growth hormone deficiency, should guide access. Others countered that patients with growth hormone deficiency had a disease deserving treatment, whereas children short from other causes did not have a disease, and that to treat them would constitute enhancement and not therapy. And that is the key statement in this entire article. You really don't need to go any further. They're just going to go back and forth batting this around. So the significance here is everything that we know about the vast majority of steroids, chemicals, medicines, it's always to treat a problem. It's never to enhance what you already have. For some reason, we can do that with plastic surgery. That's an entire field of medicine. Nobody has a problem with that. But your doctor doesn't want to give you super physiological levels of doses of testosterone to help you build more muscle than you should have. Because that's enhancement. That's not a medical problem, which is why we have such a hard time getting the data that myself and others are putting forth into the community, because basically doctors are not going to test these things. They're not going to take a perfectly normal, healthy adult and go, hey, let's run some tests to see what happens if we give them a shit ton of Trenbolone. They're not going to do that. And so we have very limited access to medical data on otherwise normal people because of the fact that they consider it to be potentially unethical. You're using a doctor to enhance your child, not to make him normal again. And so I suspect that the answer is already known. I suspect that the answer is known that, of course, just like if you give super physiological levels of testosterone to a person who has totally normal testosterone levels, they're going to build more muscle than normal. They are going to be enhanced. We know that growth hormone leads to accelerated growth. There's no reason to believe that it would not lead to accelerated growth with potential additional height above and beyond baseline in an otherwise normally developing child. But these medical researchers are not going to touch that. They're not going to take a bunch of parents and let them bring their perfectly normal kids into the lab and go, okay, let's take your kid who's suspected to be 5'10", who has no growth hormone deficiency, who has no problem. Let's jack him up on GH and anastrozole and see if we can get him to 6'2" and get him into the NBA. We're not going to do that study. It doesn't mean that it doesn't work. It just means that you're not going to be able to find any data to teach you how to do it or to prove that it does work, because according to the way that the medical scientists or doctors look at this scenario, it's not medicine if it's enhancement. And so basically this article goes on to describe it says the utility of growth hormone deficiency as a necessary sufficient criterion for eligibility for treatment is a priori problematic, since the definition and ascertainment of GHD is still controversial and elusive. That's the whole problem. Like, what qualifies for growth hormone deficiency? Is this just a number on a paper? There's a lot of variability to this. Isolated growth hormone deficiency is usually neither complete nor permanent. A continuum of growth hormone secretion spans the clinical presentations of partial versus severe, isolated growth hormone deficiency versus complete growth hormone deficiency. Children with isolated GHD without identifiable central nervous system abnormalities or metabolic evidence indicative of severe GHD comprise the majority of and the most controversial HGH treated patients. In the discussion below, GHD refers to these patients not to severe permanent GHD with hypoglycemia, identifiable nervous system malformations, and multiple pituitary hormone deficiencies. So what we have here is this tiny little window from one article that helps us to better understand the scientific community at large. It helps us understand why it is that when you go to your general and you go, hey doc, I don't feel good, I have a 500 nanogram per deciliter testosterone level, can we jack that up a little bit? He goes, absolutely not. Because as far as he's concerned, you don't have a medical problem. And he's supposed to be treating you out of medical necessity. And this is why I have said time and time again that the transgender movement opened Pandora's box. There's no way, see what they're trying to do, they're trying to sidestep it though, right? So they're trying to take this tiny little sidestep and they go, okay, well, this person doesn't have a physical problem. They don't have a physical disease. But they have, and apparently we can't say that they have a neurological disease. They don't have an insanity problem, but they feel so uncomfortable in this opposite-sexed body that now medical science is authorized to use these rather barbaric treatments to try to convert a person from one thing to another. And once you made that leap, I think that you open Pandora's box, because there's no way that you can accurately say that a person who is trans, or a person who is born a male and thinks they are female, you cannot objectively say that that person is experiencing more anguish and is more worthy of treatment than my son. Let's say my son says, hey, look, I need to be 6'2", and I need to have the musculature of Chris Bumstead. And if I can't build this body, which of course can't be done naturally, then I am going to be more likely to commit suicide. I'm going to be depressed. I'm going to have negative outcomes in my life. This is what they're telling us about the trans community, that these are life-saving operations, that they are not just barbarically carving someone up. They are trying to save their lives. And so if Cody Copa, for example, or my son Paul says, look, doc, I can't cope with my existence being 5'4" and 100 pounds. I need to be 6 foot, 275, and you can help me get there. You can help a 20-year, you can help a young man get to 6 foot, 275 a hell of a lot easier than you can turn a man into a woman with far fewer side effects. So the box has been opened, and there's no putting it back at this point. Unless we are going to completely reverse course and say, no, these people have a mental disorder and they need to be treated by a psychotherapist, and they absolutely cannot have access to any physical medical treatments. We're not going to give them cross-sex hormones. We're not going to do any surgeries on them. Unless we are prepared to reverse course and end the trans movement, then you cannot objectively say that the suffering experienced by people who are short, people who are skinny. What about a kid who, say, is 15 years old, and because his parents, genetics that they passed on, he's already morbidly obese for his age? Is it ethically justifiable to give a 15-year-old Ozempic so that he can get down to a normal weight? If we are going to treat what is clearly a mental disorder in the trans community, then you must give Ozempic to 12 and 13-year-old children who need to lose weight. You must give anabolic steroids and human growth hormone and anastrozole to young men who want to be taller and more muscular. Because this is about their mental well-being. This is about how well they're going to be able to succeed in life. We have to allow these children to become who they feel like they should be, what they feel like inside, as Dave Chappelle said. You have to legalize anabolic steroids for anyone like me who does not feel comfortable in their own skin until they have a 5-time Mr. Olympia body. Look what I just got put through psychologically and emotionally. Bob Matthews just drug my entire last 4 years of bodybuilding experience through the mud when he said that my physique would not leave Chris Bumstead in awe. And you know what? Now that I think about it, I'm feeling really upset right now. I am devastated. I don't know that I'm going to be able to go on in life until Chris Bumstead stands in awe of the body that I have built. And it now becomes a medical problem. I now have a medical condition whereby a doctor should be required to treat me with whatever anabolics, growth hormone, whatever I need to get to 265 lean. Certainly to 225 peeled and on stage, so that maybe Bob Matthews will stop attacking my character and making me feel like less of a man. Because that's what the trans community has said. So if it works for them, then it works for us. So I want to see, where is the doctor who's going to stand up and help me get, well, besides one that I can think of, where is the conventional medical doctor who's going to stand up and who's going to start legally writing me all of the drugs that I need to become Bumstead? Now we're going to need to get Congress on this, Because Bumstead only built the body he built with the use of trenbolone that he now likes to hate all over. Now he says trenbolone is too risky. It wasn't too risky when his sister was catching 6 felonies for it being delivered to their house in Miami or wherever they were staying prepping for the Olympia. Trenbolone was perfectly acceptable for him to use to get on the Olympia stage, but now he likes to go on YouTube and talk about how it's harsh and toxic and people shouldn't use it. So we need to get trenbolone, we need to get all of the anabolic steroids descheduled and made legal by prescription. If you are going to tell me that we can legally prescribe having a boy's penis removed and turned into a vagina, then we can legally write some trenbolone to people like me. This is what must take place in our society if we are going to continue the trans lunacy, if we are going to continue to allow the trans lunacy. And now we have an example, we have basically proof, where doctors wrote an article saying anything that trespasses beyond medical necessity is then considered enhancement, and that's not the purview of science. That's not the purview of medicine. So all it takes is for me to say that I am in mental anguish for not looking like Chris Bumstead. I am being picked on by members of the community. I have a medical disease that requires trenbolone treatment immediately. Immediately. Let's all write our congressman and get this stuff approved. As always, thank you for watching. We'll see you on the next one.